Thank you for joining us. This is Health Your Own Way podcast, and I am your host, Mo Atkins. Today, we're going to be talking about chronic pain and what you need to know. My guest speaker today is Dr. Mitchell Yass. He's the creator of the Yass method, which has been utilized to resolve the pain of thousands, including those who have surgery to resolve their pain with no improvements afterwards. He's been treating patients for almost 3 decades using his unique approach, which we'll be discussing later on in this episode. So I'm really excited to have this conversation because I know in this world, we all have pain in some form, right? And I think it's due to lifestyle. So, welcome, and anything you want to add before we start, doctor?
No, just that I'm very happy to be here. I love every opportunity I get to be able to help people recognize that there is a legitimate way of diagnosing the cause of their pain and resolving it. And they're going to be shocked to find out what exactly is causing it. So I think this is going to be very inspirational and hopefully help people guide themselves to be able to reclaim their lives. It's very, very important. It's a horrible situation we're in at this point. So I'm happy to be here.
I agree with you because on a personal level, I don't feel pain every day, but I do know a lot of people that have back pain, knee pain, shoulder pains, right? So, in your own words, what's considered chronic pain? Because a lot of people don't know that meaning.
So, to differentiate acute pain and chronic pain, the technical concept is that it's continuous pain that's occurred for greater than 3 months. Now, in terms of, I think before you get to chronic pain, you kind of have to understand what is acute pain and then understand how that becomes chronic pain. And so the problem I have is that the mechanism by which pain, when you have it and then seek care, is identified is typically through the MRI. I don't think anyone questions that if you have pain and you want to find out the answer, someone's going to take an MRI for you, right? Okay. So the MRI will find things like in the back, they'll find herniated discs, stenosis, pinched nerves. In the knee, or shoulder or hip, they'll find arthritis or a labral tear or a meniscal tear. So these are structural variations that they're identifying. And they're asserting that since it's identified at the time of your pain, it is considered to be the cause of your pain. This is how the system works. That is what is known as correlative theory or junk science. This is a logical position I'm taking. I'm telling you that you can't make that assertion, and I'll show you why. So, for instance, an example of this outside of the medical system is if I could say, based on this concept, if I open my front door when the sun rises, I could say opening my front door causes the sun to rise.
Okay, I'm listening.
Okay, so that's what this is. It's trying to take two things and correlate them without there being a basis of that correlation. So they're saying the herniated disc identified is the cause of your lower back pain because it's identified well you had lower back pain. So I'll ask you, what if the MRI found that you had 2 elbows at the time of your back pain? You have 2 elbows. I'm sure you have 2 elbows. I found it at the time of your back pain. Okay, 2 elbows is the cause of your back pain. Same exact theory. Now, let's take it one step further. Scientifically, if someone makes a hypothesis, there's something called the null hypothesis. Both must be true. So the hypothesis here is that herniated discs cause pain. That's what you're being told. I found the herniated disc, you have pain, therefore it's the cause of your pain. Well, if that's the hypothesis, what's the null hypothesis? People who don't have pain should not have herniated discs. Right? If herniated discs cause pain and you don't have pain, you better not have a herniated disc because you just told me herniated discs cause pain. Right?
I'm with you.
Well, by 1994, a study of people who have no back pain showed 70% have herniated or bulging discs.
I see what you're saying because
that's strange. I thought you told me bulging and herniated disc cause pain. How could 70% of the population who don't have pain have that?
So then, I know what you're saying. Basically, you're telling me that sometimes the correlation respects the fact when they find something and then you already have a pain, they make that correlation right away because they see something abnormal through the MRI. I get it. Then I think what I'm trying to understand is, or what I do understand is the fact that a lot of people, the root cause of your pain may not be what they assume the root cause of your pain may not be actually where your pain is coming from. Is that fair to say?
That is exactly it. So we could go on to the next step. So we're clearly putting a hole in the idea that you as an individual should ever trust the idea that the diagnosis of what is causing your pain can be properly achieved through a diagnostic test. At this point, hopefully I put all the holes in the world for that. And by the way, it's not just me who said this. I'll give you one really very, very large presentation. The American College of Physicians, these are the guys who set the guidelines for every doctor in the United States. In 2007, create a position on the MRI. And what they did was they did a 20-year literature search. They literally look at thousands of cases over 20 years, thousands of cases of people with lower back pain. And they come to certain conclusions. And the first conclusion they come to is that roughly 85% of people who are seeking care for back pain are put into a category what they describe as non-specific back pain, meaning like there's not a knife coming out of their back to cause it, there's not a massive tumor that's obvious. That 15% are people who, I mean, they walk in and it's obvious what it is. So 85%, that's almost everybody, it's a vast majority, are put into the category of non-specific back pain. They determine that any attempt to correlate those back pain symptoms to a structural abnormality via diagnostic testing did zero in terms of improving their outcomes.
Okay.
Zero.
I get what you're saying. Okay, I get what you're saying. Then when you're saying this out and you're telling me this and people are listening, so then what is their solution? How do they then not diagnose but determine what the root cause of the pain is then?
Now we're going to get into the Yass method. This is what I figured out 30 years ago. So let's go to how the body really works. So you have to understand that if you have pain, pain is part of the body's feedback mechanism. So evolution has developed a circumstance where if something's not working in you, the body actually allowed it to send a signal to your brain to allow you to know it's not working so that you could get an intervention and resolve the distress of that tissue, thereby allowing you to function normally, right? I think everyone acknowledges that's the feedback system. So you have to understand that every tissue is to isolate itself to let you know it's that tissue creates very specific symptoms. So a nerve creates a specific symptom, bone does, muscle does, your heart does, your liver does. You're getting specific, and the way you know that is pain at your chest and your left arm, right? That's an indication of a heart attack. That symptom is literally being admitted by your heart. Your heart's creating that symptom. And you know, oh my God, if I have that symptom, that's my heart. I need to go get that, resolved, right?
Okay.
So if I wanted to know what tissue is in distress, would the best way to be to interpret the symptoms? Because if I can catalog all the symptoms that people have and I can figure out which those symptoms are, that should let me know which the tissue is that's creating those symptoms.
Okay.
Right? That should make sense. Right?
Yeah,
now, if it's a muscle, it'll create specific symptoms. Nerve creates specific symptoms. Bone creates specific symptoms. So what did I do 28 years ago? I started cataloging symptoms. Depending on where your pain is, what brings your pain on? Is it associated with function? Can I touch on the tissue, or is the symptom referred? There are a series of symptoms other than pain itself, which everyone thinks is the primary symptom, but changes in posture. Inabilities to perform activities, flexibility, pinpoint pain versus referred pain. All of these will allow you to know what the tissue is that's eliciting your pain. And my question to anybody would be, how could you get treatment if you don't know what the tissue is? If you don't know what the tissue in distress is, how do you get a treatment? It's impossible because you don't know that you're treating the right tissue, right?
Fair enough. Yes, I agree with you.
So you need to go to somebody who can provide you the proper diagnosis. Well, we just established that the medical establishment uses the MRI as the gold standard. And clearly, it's just finding something that exists, which might be completely independent to the tissue in distress, creating your symptoms. So that's not the answer. The answer is to go to someone who can interpret your symptoms, understand what's happening in your body, and then be able to tell you what the tissue is creating that symptom. Well, over 30 years, this is the shocker, and this is you, everybody should be elated to hear this. In more than 98% of cases of those I treated over 30 years, almost 30 years, the tissue in distress was a muscle.
I like what you're saying. I don't think everybody has access to you. Okay. Everybody doesn't have access to you. I know you're trying to get access. And that's great news. I think for me, for the ones that are comfortable going to their own personal doctors and going through MRI, I know you just said that it's not 100%. Is there not another method that they can use with the MRI or anything else that could, besides maybe even using your method as part of determining what the main root cause of the issue is?
Right. So this is kind of what you're saying is kind of why it's tough to be me, and I've acknowledged it's not easy to be me. I never really liked being me until I found enlightenment. Now I love being me, but it's never fun to be the first guy who figured something out. It's very hard because I come on this podcast and people will say, he's just trying to grow business or something like that. I've been doing this for 28 years. What if I told you I only found out about podcasts 7 weeks ago?
No way. I know what you mean. I know what you mean. Yeah.
I for 28 years, go to my original website, MitchellYass.com. Show me on the website what you were purchasing to make me money from it.
Fair enough.
For 28 years, books. That's it. And trust me, you don't make any money being an author. It's really primarily just as a form of credibility to say this guy is an author. He's written something, and a publisher felt it value enough to publish it, right? So when this all happened, I said to myself, I think I've been chosen for this unbelievably unique opportunity to be given the ability to have this knowledge, and therefore it is my moral and ethical responsibility to make it available to whoever seeks care. Whoever I through my enlightenment, I began to get the understanding of the difference between righteousness and wisdom. Righteousness is knowing I was given this gift of knowledge, and therefore everyone has the right to have it who is in pain. And by the way, that's 130 million Americans, roughly 1 billion people worldwide.
Yeah, and a lot of people are in pain.
Yeah. Wisdom is recognizing that I can only help those who are willing to seek it. See? If you're caught up on some other mechanism and you think if you want to believe that the MRI works because 1,000 people told you that, then you're never going to seek this, and God bless you. I mean, I can't make you believe in this.
Fair enough, doctor. I think for a lot of people, when they're listening to you talking, you seem very passionate. I think I know I can feel that you want to help people. I think for a lot of people they just assume that once an MRI is done, they've been given the pills, there's nothing else, right? They don't know there's anything else, right? That's it. And even a lot of doctors are being told this. They're just being taught what they've learned from school. So there's nothing beyond that. Is that fair to say?
You just hit a great point. Okay. So here's something. So let's say that you had lower back pain and your MRI said you had stenosis and you got a 2-level or 3-level back fusion. And now you're in more pain than you were before the surgery. Okay. So you're looking at your situation, and maybe you're a year into this now and time's gone on. What I want people to understand, and by the way, I actually went through this. I have a doctorate in physical therapy. I was given the same education hundreds of thousands of other people have. I would say to that person, would you be willing to say to yourself that it might be when you think about the person who gave you that surgery, could you say to yourself, it's possible that that person just doesn't know what they don't know?
Yes, 100%.
Okay, so is it possible that their passion, their desire to help people, but their education and training really didn't put them in the position to resolve my pain, which is why I still have the same, if not greater pain? Can someone be willing to make that 100%. Assertion?
I can say it right now, yes, 100%. You can see it every time.
Okay, good. Okay,
Yes.
because that's the part of this that becomes very hard because there's also a psychological component to this. So
Okay.
you decided to have that surgery, and once it failed, and you're still in pain, if not greater pain, this I'm telling you from personal experience of treating thousands of people, the person will begin to think it's their fault. They should have known the surgery wasn't going to work. It didn't matter what that guy said. All the evidence, failed back surgeries rate in the 70 to 80% range. And so the person now, and this is the danger of what happens with people, begins to say, I can't leave this process because I'm in it. And if I try to literally walk
Yeah.
completely away from it, I'm indicating it's my fault that this happened to me. You have to understand. I have looked at the spiritual, emotional, and intellectual elements of this situation because I've been doing it. I have treated hundreds of people who literally walked up to me and said, I am putting a bullet in my head tomorrow if you do not resolve my pain. I will not be able to live one more day. I've tried it all. You're my last resort. You're it. I'm telling you now, literally standing in front of me said, I'm putting a bullet in my head. You have to understand how sobering that is for someone like me. You have to understand how all of a sudden your level of concentration becomes so heightened that you will literally say to yourself, you'll do anything for this person. That's basically been my driving force. Why? I got the same education as hundreds of thousands of others. And once I recognized from a logical perspective that it wasn't making sense, I was willing to say, I don't think I actually know I don't know what I don't know. And I need to know more. And that's what started me on this path of trying to understand everything I'm telling you now. This theoretical basis of what is pain? Why do we get pain? What is its relationship to the tissue in distress? I didn't get that in school. I got that after. I had to learn this.
That's a good thing because I think a lot of people stop educating themselves afterwards. They just
Correct.
assume, and that's fair. Like if people were interested, let's say somebody was watching or listening to us right now and they wanted to learn more about the Yass method or maybe have a conversation with you. What is the best platform to reach you out on?
So you could always reach me by email, and if you Google my name, it's going to look like this guy. You're going to think that this method has been implemented globally amongst the medical systems. It's nothing like that. I'm just a singular guy who's figured something out. So I want everyone to understand, if you email me, you're going to get an email back. You could always email me. That's Dr. Mitch at mitchellyass.com, DRMITCH at MITCHLLYASS.com. I would also recommend, if you want, going to my website, livewithoutpains.plural.com. So livewithoutpains.com. And if you put /sessions, you'll go to the page that talk about the Zoom sessions that I provide. The majority of the work I do is through Zoom session. I'm in Jacksonville, Florida. I've written books that are sold in the United States, Canada, England, Australia, India, and South Africa. I write for an international magazine sold in 20 countries, translated into 14 languages. I have been for years being contacted from internationally, right? So before there was even Zoom, I was doing Zoom through Skype, right? I've been doing this for 5 or 6 years, way before telehealth, right? And so I suddenly, so it's now I meet this friend and he's a business guy and he's like, Mitch, you've treated 15,000 people. I think your goal in your life is to treat 15 million people. Well,
Okay.
you kind of have to do something more than just have a place where someone can find a book. If you want to work with them, you got to set up a mechanism for that to happen. So he was the one who helped me understand how to make the website that you can understand how the Zoom sessions work. And by the way, there's even a raw video of someone getting a Zoom session.
Oh, that's
I
nice.
got her to say it was okay because and everybody's like, oh, just take bits of it. No, I want someone to literally, if you're willing to sit through this, you'll see exactly what happens in that Zoom session.
I like that. So don't worry, we will have your website details on the bottom so people can
Great.
just yeah. So
Excellent.
I think if anybody's watching or listening, like I can tell that this is a passion of yours. You're very well Like I even started talking to you. I was like, okay, this doctor knows what he's talking about, and he knows that this is because you know what, in reality, a lot of millions of people are dealing with pain from a variety of areas. And even some of my clients, when I see they're in pain, I'm saying that because you're pointing or your back is like certain areas that you're pointing at, it may not be the root cause of your pain. There's different underlying issues that you have to address. And I'm well aware of that. And I think mentioning to everybody, whoever's listening or watching, is that, sometimes the conventional way of determining what your chronic pain is may not be the only solution or way to do so. You may have to look at other things before you go underneath the knife. Is that better? Is that right? Look at other
Sure.
ways to do. Yeah. Okay. Just want to make sure I understood what we're saying, Dr. Mitchell.
Yeah. So here's people often say to me, okay, so there's this layperson at home. How are they going to begin to implement this method that you're describing? So the first step I think you have to do is say you have to understand that the symptom you're having, that pain, is coming from a tissue. We have to accept that. And we have to understand that the diagnosis you're given has to have two elements that make it be proven that you are getting the right diagnosis. Number one, you have to name a tissue. What is the tissue in distress? So I often try to use the idea someone's in a car accident and they're given the diagnosis whiplash. Can someone show me on an atlas or anatomy chart where whiplash is? Because I don't think I've ever seen that tissue. Right?
Okay. I
Right?
get it.
So you have to understand that if you're given the diagnosis whiplash, how do I know, is it a disc that's been affected by the mechanism? Is it maybe you have a fracture of a vertebrae? Maybe it's a muscle how would I know based on that diagnosis? And yet people are given the diagnosis and that's sustained for 10 years, 20 years. And then they wonder why they're not getting better because you're using a diagnosis that doesn't give you the basis of knowing what it is I'm supposed to be treating to resolve the distress of that thing so it stops eliciting your pain.
Fair enough.
Right?
I agree with you.
So you have to have a tissue. This is the home run. This is what makes the Yass method the Yass method. The second part of this is that the symptoms being experienced must be the exact symptoms that would be created if the identified tissue was in distress.
Okay.
Right?
Okay, I get it.
So I'm going to give you an example. Here's a really good example. So a person comes in and they're complaining of pain around their kneecap. Really common. Lots of people complain about pain around their kneecap. They get an MRI and it says it has a torn meniscus.
Okay.
Since the torn meniscus is identified at the time of the pain, they're going to say that's the cause. Let me teach you something. So the meniscus is this spongy tissue that lies between the thigh bone and lower leg bone, right? And to feel that area or identify if the meniscus is eliciting a pain, there's a space that sits to the side, right between the thigh bone and the lower leg bone, called the joint line. There's one on the inside and the outside. Okay? So if someone had a torn meniscus, you have to press on the joint line to get them to incite their pain.
Okay.
If I want to make their pain worse and touch that meniscus, I have to press on the joint line. There's no choice. That's where okay. Now, it turns out that the knee is actually comprised of two joints. The joint between the thigh bone and the lower leg bone, and then the joint between the kneecap and the thigh bone.
Okay.
The kneecap runs through a space called the intercondylar groove, and that's the part of the thigh bone. The bottom of the thigh bone has these two things called condyles, and there's a space between it. This is where the kneecap runs. So there's a joint between the kneecap and the thigh bone. So if you're having pain here, how could a tissue here create that pain? It can't. It's impossible. They're two separate joints. Completely two separate joints. That's like saying, I found arthritis at your elbow, and that justifies the pain you're having at your ankle. Arthritis at the elbow causes ankle pain. It's the way it works.
But are you saying that some of the diagnoses when it comes to like the issues in knees are incorrect because the root cause could be something else?
So If we now go on to this idea that your pain, as I said, in 98% of cases is muscle, then you have to begin to understand that for you to function, and by function, I'm describing the fact that there's a gravitational force pushing down on you. So therefore, for you to do any activity, you have to push up against that. Whether it's to walk, to stand, to grab something, everything you do is always in a vertical direction. This is pushing down on you, and you have to push up against it. That's the way, that's what it is to live on Earth. So there's a force requirement for activity. Standing, it costs a certain amount of energy. There's a certain force pushing down. Walking, there's a force, right? Because if you didn't have the strength, what would happen? The force would push you down and you'd end up being on the ground. You don't have a choice, right? So your muscles have to push up against that force.
Okay.
So your muscles create a certain force output.
Yes.
The muscles have to push up against the gravitational force of down. So if the force output of your muscles is less than the force requirement of your activities, your muscles are going to strain.
Yes.
The need that they have to create is greater than the need they can create. So they strain, right? You have to, right? So you have to understand that it's not one muscle that's helping you stand or walk, or it's multiple muscles, which means that let's say you have 8 muscles involved. You better know that all 8 muscles have enough force output than the force requirement of the activity. Or if one muscle is weak, it's going to strain.
Yes,
and it's going to lead.
Yeah.
It's going to lead to other muscles trying to take the load from that muscle. Those muscles are going to strain, most likely elicit a symptom. And that's why the cause of pain in muscular cause in more than 99.9% of the cases is not where the pain is being experienced. So I'm going to go back. Let's go back to our kneecap problem. The person's having pain at their kneecap, right around their kneecap, right? Well, you have to understand that the kneecap is controlled. Remember, it runs through that joint as you're bending and straightening your knee. It's controlled by the muscle that sits above it on the front thigh called the quadricep muscle.
Yes, your quads. Yes.
Okay. So let's say that your quadricep straightens the knee. The hamstring, the posterior thigh, bends the knee.
Okay.
So they're opposing muscles. One does one, the other does the opposite. So let's say that the hamstring just isn't quite as strong as the quad, which is very common to occur. The quadricep will then shorten.
Because it's tight.
Okay. The shortened quad is attached to the kneecap via something called the quad tendon. So now there's a upward force, an excessive upward force pulling on your kneecap. So when you bend your knee, the kneecap's not gliding through, it's compressed through.
Yeah.
So the cause of the pain at the kneecap, around the kneecap's not the kneecap, it's the thigh muscle.
Yeah, I get what you're saying. I understand.
So we would just have to correct that muscular cause, and that's what takes the pain at the kneecap away.
No, I understand what you're saying. I feel even when I speak to some of my clients, when they have like low back pain, I say a lot of your issues may not be the back itself. It could be your quads are tight, your hamstrings are tight, your calves could be an issue. There's a lot of underlying, and I agree with you. Even sometimes, I remember when I had shoulder problems, it wasn't the root cause, wasn't my shoulder per se. It was more of affecting my, like, could be my shoulder blades at the back. There's also, I'm with you, John.
You got it. And so when you talk about the shoulder, I'll just give you a little understanding of why the shoulder is such a magical joint. The shoulder allows us to have 360 degrees of range of motion. Now, for every joint, the joint's evolution is going to be based on 2 opposing forces, mobility and stability.
Okay.
So if we need lots of mobility, you can't have a very, very deep joint. You can't have lots of ligaments, because in developing that much stability, you're not going to have a lot of range of motion. You can't develop lots of stability and lots of mobility. It's one or the other. So when you look at the shoulder joint, you recognize it's very shallow. It's not a deep ball and socket.
Okay.
Okay. Now, to get 360 degrees of range of motion, it wasn't like it was going to be easy to create 360 degrees at one joint. So what you really want to recognize is that the shoulder joint is the arm bone actually attaching into the side of the shoulder blade.
Okay.
Now, the shoulder blade is held on the rib cage,
Yes.
not by ligaments, not by joint capsules, by muscle. Muscles hold the shoulder blade against the rib cage.
And the muscles are tight.
So
I
think
know.
about how unique this is. You have your arm bone moving, and the other side of the other bone that makes up that joint is supposed to be this very stable location so that the arm bone can pull off of it and move the shoulder. Well, the other side is your shoulder blade. Your shoulder blade isn't stable, it's just held by muscle. So you actually have in the shoulder joint, which makes it so unique, you have a joint where neither side is stable. And so the health and the function of the shoulder joint is based on the health of the ability of the muscles to keep the shoulder blade against the rib cage.
Interesting. I have a lot of clients, a few that have frozen shoulders. I have a lot of clients that don't have limited mobility and pain when they have to come on the shoulder. So a lot of issues is not related specifically to the actual shoulder. It could be tight chest and weak thoracic issues, stuff like that. I'm fully aware. And even sometimes it could be literally your arms and like your weak muscles in your arms and stuff like that are affecting the whole movements. And I get it. And I think, you've said a lot, and I understand what you said, and I hope people that are listening understand what he's saying. And high level summary, if you haven't picked up, we're basically saying that some of the root causes of your pain, it may not be the actual area where you feel the pain. And he's also stating that at time, not 90% of the time or more, that your root cause of your pain is leading to more of a muscle issue or muscle deficiency in a sense. So if you're interested in reaching out to him or learning more, we have his website here. We've mentioned it. And I think before I let you go, doctor, what is next for you? What are you doing? Are you doing anything else? What can you share that we could be excited to see for you in the future, sir?
So it's so funny when people say, what's next for me? It's the beginning. After 28 years, I'm literally at the beginning. And it's what we talked about. I've suddenly decided through a good friend of mine guiding me that I need help in creating, if you will, a business model, if you want to call it a business model, but it's designed to create greater awareness, to make the method more accessible. So just through experiences, like I told you 7 weeks ago, I just found out there's this thing called podcast that I can come on and talk about and talk to people and help them become aware. I just created the website.
YouTube. YouTube
as well, right? I never even knew what Instagram was until a few weeks ago. I mean, I'm really being guided, thank God, by these people. And so what we've recognized is through this process of creating awareness, this is obviously going to get beyond the single guy. So I'm in the process of creating a certification program. I am going to certify Yass Method Zoom specialists, which will be able to do these Zoom sessions as the population grows who wants them. I'm going to make sure they're certified. And so people understand there's 3 levels just to be able to do Zoom sessions for one body part. It's a 3 to 6 month process. It's a university level course I'm creating. They actually have to have an exam and then actually come to me. These people are going to be where I want them to be. One point I want to make about the Zoom sessions, which I think people would find very important and recognize its value, is that every time you get a Zoom session, it's videotaped, right? So here's the magic of it. You get to use that over and over again. So you get a Zoom session with me. The design of the system is that I know that you have a muscular cause. I know you have to do the exercises, but my opinion is upon understanding which exercises, how to perform them accurately, and then how to use progressive resistance to strengthen the exercises, I don't think you need me to stand over you. So what I believe is that you get that one session, you understand everything, and I'm supervising you, so we know you're doing it correctly. Then you take that video and allows you to do your next 11 sessions. You do usually the strengthening 3 times a week. So you're going to use that, and you're going to watch me demonstrate it. You're going to watch yourself do it, and then you're going to do it with yourself again. So the idea is that that first Zoom session is carrying you for 4 weeks. At the end of the 4 weeks, you get your follow-up session. That's where we're going to check. Are you achieving your goals? Are you having less pain? Are you becoming more functional? You're going to do the exercises again. We're going to make sure you're using the right resistance. Again, it's videotape. That becomes the new supervisory mechanism for the next 4 weeks. So in my mind, I am so concerned. There are lots of people who have come to me and said, I am literally tapped out. I've spent thousands, whether it's for surgeries, cortisone shots, medications, every type of treatment, plasma therapy, stem cell therapy. They've gone through it all. And so I am very keen to the idea that I want this to be something reasonable that pretty much anybody can afford it. You got to do that way, especially if you think you have this moral and ethical imperative, right? So I thought that this was the best use of time and money. And I've been doing it this way for years, and I still think it is the most effective way for the person to get the most from the method at still a cost relative basis.
No, I agree with you. And I think, that you have something there. I think for a lot of people that are watching or listening, if you are in some form of chronic pain, or if you know somebody is dealing with some chronic pain that's gone through everything, it doesn't hurt to be open to new ideas. You never know what kind of solutions are out there. I want to say, Dr. Mitchell, yes, thank you for your time. I've learned a lot. I appreciate this conversation. I hope whoever is watching or listening, if you're feeling pain, pain is not, you don't have to live in pain. There's some form of solution. If not, there's a way to mitigate it. And pain's not fun. It's not fun at all.
It's horrible. It affects you emotionally in very, very bad ways. And that one point about that is that eventually the emotional distress, anxiety, frustration, and hopelessness ends up superseding the pain. That becomes the focus. And once that happens, that person's in a very dark place, and they don't have to remain there. Identify the cause of the pain, resolve the cause of the pain. There is no more stress about it.
Fair enough. Thank you, sir. I appreciate this conversation.
Oh, thank you. Thank you for having me. It was wonderful speaking to you.
We're glad to have you join us. Don't forget to subscribe, leave a comment, share with anyone that needs to be empowered and inspired, and don't forget to join us next week for the next episode of Health Your Own Way podcast. Have a good day, you guys.